nominate Honorable Tajuddin Abbas.
I so second.
I rise to humbly accept the nomination.
Is hereby declared the winner and returned elected as the Speaker of the House of Representatives.
Glad to have you join me on another fresh package of House Ticket. I am Rashida Abubakar, standing in for your regular anchor. In our lineup, lawmakers investigate the National Hajj Commission of Nigeria, NAHCON, over the 2024 Hajj exercise, discrepancies in subsidies to pilgrims. This is one of the focal points of our program on this episode of House Ticket. Also in this package is a one-day public hearing of the House Committee on Health Institutions. We'll wrap up today's package with an extensive interview with lawmaker Jeremiah Umaru. Full details of these stories when the program begins after this short break. Stay with us. We'll start off the program with the public hearing by the House Committee on Health Institutions to scrutinize system bills aimed at establishing health institutions across the country. From there, we will take the details of the investigative hearing on the activities of NAHCON over the 2024 Hajj exercise. Let's get this report as compiled and presented from our studio.
Honorable Dr. Midala. Thank you.
During the public hearing by the House Committee on Health Institutions, the Speaker, who was represented, encouraged participants to collaborate with their legislators in making sure that all legislations that emerge from public engagements produce laws of high quality for the benefit of Nigeria and Nigerians. He then spoke on the importance of the legislations under consideration for the Nigerian country.
Its submission and recommendations of the committee that the House will rely on to pass or make relevant laws for the good governance of our citizens, as enshrined in the 1999 Constitution of the Federal Republic of Nigeria as amended. The onerous responsibility bestowed on the House Committee on Health Institutions by both the House Standing Rules and the Constitution is achievable when the caliber of its leadership and membership are taken into consideration. The present 10th House of Representatives, at its inception in 2023, set out for itself a legislative agenda whose implementation would surely bring about tremendous improvement in the living standard of our citizenry. Today's hearing, no doubt, is in line with the agenda, and so also I expect the outcome. Distinguished stakeholders, I wish to urge you to freely express their views, so opinions, either for or against the subjects of this hearing, in a manner that will bring about the sustenance of our collective will.
I am delighted to welcome you.
In his welcome address, Chairman of the committee, Representative Amos Magaji Gwamna, stated the purpose of the hearing as being to provide guidance for the actualization of the federal government's commitment to improve healthcare delivery through the wide distribution of health institutions in Nigeria. He said as a result of the growing population, there is the need for reference hospitals closer to the people, particularly in rural and suburban areas.
This is the backrock upon which the bills under consideration in this public hearing have been sponsored by honorable members of the House to bring healthcare services closer to the people. After all, the World Health Organization defined access to health as universal health coverage, which means that all people have access to the health services they need, when and where they need them, and of sufficient quality without financial hardship.
Representative Gwamna also argued that the mass exodus of health workers and professionals to other countries presents a significant challenge to Nigeria's healthcare sector, leaving Nigeria's health sector severely understaffed.
To provide for the establishment of...
In his remarks, The Minister of Health, who was represented by a director in the ministry, Dr. Jimo Olawale Salahuddin, noted that health sector research in cardiology is already taking place in many fronts in Nigeria. As such, establishing a specialized institute like the proposed National Institute of Cardiovascular Disease Research and Treatment Center will be an additional burden on government. He explained that government is cutting down on the cost of governance by pruning down agencies of government. He said while the ministry appreciates the effort of the House of Representatives in deepening healthcare services, including training and research in the country, cardiovascular research is not more important than other non-communicable diseases.
Having made necessary consultations with relevant stakeholders, we wish to submit on the proposed bill as follows. We appreciate the effort of the House of Representatives in deeply health care services, including training and research in the country, and wish to state that the ministry will continue to give our support toward the actualization of laudable health projects. However, we wish to note that cardiovascular research is not in a large level than any other non-communicable diseases to warrant a compelling need for the establishment of National Institute of Cardiovascular Disease Research and Treatment Center in Kano. All federal teaching hospitals and federal medical centers in Nigeria, including those in the Northwest geopolitical zone, already have the mandate of treatment of cardiovascular diseases, research and training of all healthcare professionals, including medical doctors, who are specialists in the management of cardiovascular diseases and other related matters.
Establishing the College of Health.
Some of the sponsors of the bill spoke on the merits of the bills.
Establishment of this medical center is long overdue in Jigawa State. With a population of over 5 million people, lack of federal medical center forcing residents to travel long distance for quality health, this amendment will address the healthcare disparities in the region.
The college, when established, is very important to the people of Yobe State, as the effect of Boko Haram, as we all know, the insurgency, has affected the education and training of our nurses, midwives, and other healthcare providers. The college will also help in producing more nurses, midwives, and health officers in Yobe and the neighboring states of Bauchi, Gombe, Borno, Jigawa, and the entire northeastern region in general.
Access to quality healthcare remains a critical issue, with many of our people unable to receive a medical attention they deserve. Establishing the College of Health Technology Zone is not going to be just an educational initiative. It's going to be a response to the growing demand for skilled healthcare professionals. Establishing this bill will have significant advantages and economic impact on the local communities and a broader region.
It is necessary to have.
Other invited stakeholders present at the hearing also made their presentations.
Given the circumstances that is on ground now, sir, I want to say that there's a growing deficit in the medical and medical personnel in the country, and in Yobe it's even much more. The bill to establish this institution is not only timely, but is compelling.
As far as the CMDs are concerned, the more training institutions that we have, the more health personnel we'll have in Nigeria to manage our healthcare facilities. We're in support of virtually every new institution to be created, as long as the human, the resources to establish it, and it will be helpful.
I believe that it is necessary to have an institution specifically situated to deal with cardiovascular disease, just like you have the National Eye Center and all that. In the course of our regulation, especially in professional discipline, we deal with cases where people complain about treatment and all that, and there is a lot of cardiovascular disease reflected there. So we believe having that institution would go a long way in alleviating that. Thank you very much.
This hearing.
In another committee room, the ad hoc committee carrying out investigation of the National Hajj Commission and FCT Muslim Pilgrims Board over the 2024 Hajj exercise queried the commission over discrepancies in subsidies to pilgrims.
Full subsidy, half subsidy, and some pilgrims no subsidy.
In his welcome address, Chairman of the committee, Representative Sada Soli Jibia, said it was the duty of the committee to ensure future Hajj operations are a source of pride for Nigeria, and that every pilgrim's journey is safe, organized, and spiritually fulfilling.
Let us work together to ensure that future Hajj operations are a source of pride for Nigeria, and that every pilgrim's journey is safe, organized, and spiritually fulfilling.
Commissioner for Operations NAHCON, Prince Olarewaju Elegushi, had represented the chairman of the commission, Abdullahi Saleh Usman, but the committee insisted on the appearance of the chairman.
Please give your chairman the chair.
Chairman of the National Hajj Commission, NAHCON, Saleh Usman, eventually joined the hearing.
Let's begin to discuss about this public hearing. We have your submission.
I have something to say about the submission.
So, you want us to talk about it now?
Yes.
So, I will give you space to begin to talk about it now. Or if you want to ask your officers.
Okay, the Commissioner of Operation will talk on my behalf.
We'll talk on your behalf. Fantastic. Mr. Commissioner, are you going to talk to it or you are going to read?
I have.
So that we know.
I have the talking point already. Okay. That
so at every point in time, if you are making reference to your document, tell us exactly where you are.
The number of pilgrims we are lifted to the Kingdom of Saudi Arabia from the state and the armed forces. We are lifted 50,867 pilgrims from all the states and the armed forces. Then the tour operator lifted 12,881 pilgrims. And I also touched the airfare paid by each pilgrims from each region of the country. From north, $1,679.97 was paid by each pilgrims from the northern part of the country.
1,000?
$1,679.97 as airfare. And then for state far north, because of the closeness to Saudi and in terms of the travel time, they paid $1,650.70.
Excuse me, you are given subsidy, full subsidy, half subsidy, and some pilgrims no subsidy, and they are all Nigerians.
No, those people that did not enjoy subsidy, they came in after we've closed the registration of pilgrims that will enjoy that subsidy. They came later.
As long as they are Nigerians and they are pilgrims, they are supposed to enjoy the same privilege.
I think what happened is that they've exhausted that line, that subsidy line, before they came in.
Why must you register people when you have closed? That is why you continue to have these hiccups.
The committee questioned the Commission on the disparity in basic travel allowances and exchange rates for pilgrims, as well as patronizing foreign airlines for the Hajj, at the detriment of local carriers, among other issues.
Okay, give us the recommendation and the provisions in the Basa agreement that there must be a Saudi air carrier. Why are they not airlifting Niger Republic? Why are they not airlifting Cameroon? Why are they not airlifting Chad? Why Nigeria? Why are they not airlifting Indonesia?
Mr. Chairman, sir, that is a policy we met on ground.
That's not a policy.
They are even, Mr. Chairman, they are really dragging it with us.
These are some of, they will drag with you because it has been planted. These are the issues why this public hearing is going on.
From 15 to 30th, different dates, and it's different rates. The rate ranges between 1,502.63 to $1 to also 1,481 to $1. We have different dates. On the 15th of May, we applied 1,502.63. On the 16th of May, 1,492.58. On the 17th of May, 20th May, 21st May, 22nd May, 23 May, 24 May, up to 30th May. Different rates.
FCT.
Yes.
If you calculate this rate with what you paid, how much will you get? How much each FCT pilgrim will pay?
The amount allocated for the BTA on each pilgrim as at that time was 625,000. So 625,000 at that time cannot pay $500.
What can you get?
It's 410, 15 or something like that.
Did you give each FCT pilgrim 410?
No, 400, sir.
Why is the 10?
Well, there are some issues that we are still trying to resolve.
These are
with
the
Commission
problems. These are the problems. You see, a villager who is in Karshi,
yes, sir.
You took his $10. It's big money. And you cannot explain to him.
No, I think that's how we are still reconciling. When we get money back, I think we are...
Reconciling with NAHCON?
Yes, sir.
Oh, NAHCON still is involved in the BTA?
No, they are not involved because of Hajj payments, sir. Like you said, there are some pilgrims that may not traveled, but we already made remittances to the Hajj Commission. After we return from Hajj, we sit down, reconcile, they refund the money to us on those pilgrims that have not traveled.
No, that one is settled. You are not reconciling on the BTA.
What do I say? If they refund the difference.
So they want to refund some money to you.
The pilgrims.
But the BTA money, you do not give it to NAHCON.
No, sir, you know, during Hajj operations, the total number of pilgrims that we have to remit all the money to Hajj Commission.
Even the BTA?
No.
Okay, FCT.
Yes, sir.
Please take note of this. Let me request this. Okay. Please give us the total money you credited to the banks to the for BTA and the total dollar content that was given to you to give to the number. Give us the number of the pilgrims, the BTA, and the money you credited to the banks. We need that information.
The committee, at the end of the opening day of the investigation, spoke on the ongoing probe and the expectations that the probe is to achieve for the interest of the country.
The committee, on behalf of...
Glad to know you're still there. As I mentioned at the beginning, we had an interview with lawmaker Jeremiah Umaru in his capacity as the Deputy Chairman, House Committee on Public Accounts in the 10th House of Representatives. In our chat, the lawmaker told us the extent to which the House Committee on Public Accounts has been able to hold public office holders accountable.
The committee, through our commitment, our dedication, and the contributions of members of the committee, we've done so far. We've done due diligence on Auditor General's report and other issues, issues on infractions, financial issues, petitions, and the rest. And so far, we've laid a report on some investigations we've done at the floor of the House. For consideration, and it's been considered.
He also shared with us the major breakthroughs of the committee in the discharge of its duties.
If you go to Public Accounts Committee hearing room, you see computers everywhere with the support of our partners like the NCC. They made it possible. So usually or before now, when you go to Public Accounts hearing, you go with truckloads of documents. But this time around, our committee in the 10th Assembly, we've been able to automate the process so that you just send us documents via email, in soft copies, basically. And we're also perfecting the process of doing e-hearing, so that wherever you are, we can take you on. So you don't tell us that, you're not around, we should adjust the date. No, if you're in America, we can take you on. Speak to a document and so on. So These are some of the major, this is part of the major breakthroughs that this 10th Assembly has achieved so far.
Representative Umaru spoke on funding being a major issue of the House Committee on Public Accounts.
As a Public Accounts Committee, you need funding to build capacity of our members. It's a financial issue. There are issues that has to do with infraction, that has to do with public procurement processes, and so on and so forth, governance, corporate governance. So we have members who are from different backgrounds. We have accountants, lawyers, and the rest. So that capacity building is one area that is lacking. But that capacity is one area that is lacking because of funding. But so far, we've been able to, train some of our members, or most of our members, to build their capacity. So the funding is actually a challenge because as a public account, we need to be independent. So imagine we want to take on, for example, CBN, and you don't have the capacity, you don't have the funding. You will now be looking at, okay, what do we do? We need to be independent. Just like Office of the Auditor General, without that independence, you'll not be able to do your work properly.
As the Deputy Chairman, House Committee on Public Accounts, lawmaker Jeremiah Umaru told us how well he has been able to complement the effort and leadership of the Chairman of the Committee on Public Accounts.
We have worked together like family, not only me, not as Chairman and Deputy, even as a committee. We have been able to work together as one family. So if I have issue with the Chairman, I discuss with him. Chairman, you did this, I don't like. And if he has issues with me, Deputy, you did this, I don't like. And we'll apologize and move forward. So that has been helping us. And as much as I can, I try to always be there to support my chairman so that we'll be able to achieve. Because if the committee feels, it's not only chairman, it's all of us, committee, we didn't, so we try to see how we can. And in terms of commitment, I can tell you that my number one committee in this house is public account.
The legislator also spoke on the progress made by the 10th House since inception till date.
I will say that the 10th House of Affairs is so far it's been very peaceful, very calm. That's because of the kind of leaders that we have. We have a speaker who try to carry everybody along. And his nature is not, it's somebody that is approachable, it's somebody that is personable, it's somebody that is very concerned about your program to be going well for now. And we believe and we pray that we'll continue to support our speaker and the leadership so that we'll succeed together.
Lawmaker Umaru also shared his thoughts with us.
For me, so far so good. Yes, the pressure is much, especially the fact that I'm representing a senatorial district. What I mean by that is my federal constituency is the same thing as my senatorial district. Unfortunately, for us or for me, my senator is indisposed, so the pressure is much. Then, of course, looking at also the entire society and even world at large, there are a lot of issues, affecting the people and so on. So that pressure, is actually much. But we thank God we are moving forward, doing our best to ensure that we will bring programs and projects that will help and touch the lives of our people.
On a final note, lawmaker Jeremiah Umaru had a message for Nigerians.
Let's continue to support the system. Let's continue to support the government. Let's continue to pray for our leaders. The truth is, we only have one country called our own, that is Nigeria. So imagine if everybody is saying nothing is happening in Nigeria. In fact, the Americans, every time they say, God bless America, God bless. Why can't we even say God bless Nigeria? So we need to be patriotic. We need to build our nation called Nigeria. We need to also be deliberate about our communities.
Many thanks for spending your time with us on House Ticket. Remember that you can always visit our social media platforms to direct your comments and questions, and even watch previous episodes of our program. Let us meet again next time for more on the activities of the 10th House of Representatives. Until then, enjoy the rest of your day.